Welcome to the Long-Term Care Chronicles podcast. So in today's episode, we're going to be discussing eConsult and speaking with Dr. Celeste Fung, who is the medical director at St. Patrick's Home in Ottawa, as well as Dr. Clare Liddy, who is the interim chair at the University of Ottawa Department of Family Medicine, as well as a clinical investigator at the Lamont Primary Health Care Research Centre. She is a senior investigator at the Bruyère Research Institute in Ottawa. So I just wanted to thank you both, Dr. Liddy and Dr. Fung, for coming on to the Long-Term Care Chronicles and speaking in regards to the eConsult. So we'll start off with you, Dr. Liddy. What was the need that you guys were filling with this particular eConsult to just, in the community and in long-term care, that you felt that this was going to be, something that is needed to move forward?
Yeah, great. Thank you for the question. So I think first and foremost, I'm a family doctor, and I refer my patients for specialist care, quite frequently. And originally, when we started to think about improving the system, it was very much because of wait times. So I would refer a patient, and then unless it was an emergency or very urgent, I was getting an answer back from the specialist office that, we'll see the patient, but, can you let them know that it might be 6 to 9 months before they actually get seen? And this was an increasing problem, and we started to see it across many different specialty services. So that's really what prompted some of the discussions that Dr. Keeley and I had about, could we do something as doctors to try to improve this whole referral system? Was there a different way that we could try to access the care and advice for our patients? And often for me as the family doctor, it could be something that could be quite simple. And if I could have a conversation more easily with the specialist about my patient, then, maybe I would be able to carry out more care. So that's really what prompted the whole project at the beginning. And we knew between the two of us, I'm a family doctor and Dr. Keeley is a specialist, that a lot of the issue, or we thought, could be solved if we could create some kind of a communication tool that would be a little bit easier for each of us to manage. And so that's why we did not sort of do a telephone service, and we were just trying to keep something really simple. And that's where the whole idea of eConsult, which initially we thought we could just do it by email, but that's where it started. Once we tested the system and got it going, and saw that, okay, we think we're on to a good thing. And we had a small number of doctors who were using it and were very positive about it. That's where we were able to then think about, well, where else could this problem exist, and what other sort of healthcare settings? And I think the long-term care setting was one that was obvious that there could be a need, and maybe we could try to see if the eConsult service could be helpful in that environment.
Thank you. And then with the turnaround time, because you're saying it was taking anywhere from 6 months to 9 months to get a referral back, what is the turnaround time that you've seen currently with the eConsult?
Oh, well, eConsult, the turnaround time is almost, for most of the cases, within 1 to 2 days. All of them are answered within 1 week. So it's a huge difference in terms of the access to the advice. Now, this is a conversation that's happening between the family doctor on behalf of the patient and the specialist. So that's different than a face-to-face referral visit, but it's very much, it's so timely that you couldn't even, in some cases, have put in the paperwork to have initiated that face-to-face referral, and you're getting some kind of an answer back. Now, the answer back can either answer your question. So, if it's a question of diagnosis, I might have sent a picture with a skin lesion. I might actually get the diagnosis back and some advice in terms of, what to do next. It could be a recommendation of further testing, or it might be that, no, this patient really needs to be seen, in which case I would initiate that face-to-face referral. And it can greatly help in terms of the helping with the urgency piece of it. So whereas a previous request, I might have then waited for that 6 to 9 months and not really being aware that, okay, this actually should be, and I should push it more. Again, the opportunity to have that dialogue or conversation with the specialist that quickly can really change the course of things for the patient community.
Great. And then you're looking at, so basically that is increasing the patient care, and as well for the system itself in terms of what that costs, is that is more or less than what would be a traditional referral that you're sending off to a specialist.
Oh, absolutely. It's a cost savings across the board. And again, I think Dr. Fung will talk about that in the long-term care environment. But the actual cost per case is about $50, which is substantially less than a traditional face-to-face referral. So that's paid by the Ministry of Health. But then if you start thinking about the costs for the patient and their family, costs of time away from work, in the case of older people, often they'll have a family member accompany them. You need to pay for parking. People in the rural communities often have a substantial drive to access that specialist. So if you can get the advice for the person that can then be discussed and carried out or actioned by their own family doctor in the local community, it's much more efficient all around. Now, if the person does need to have that face-to-face visit, of course, this is not a substitute or intended to completely replace them, but it's a really very complementary way of being able to access care.
And for how long has this eConsult has been around and that you've been using it?
Well, originally started as a research project, and we were funded now 11 years ago. So Dr. Keeley and I started to think about the idea actually in 2009 and received funding through an innovation fund in 2010. So for the first 2 or 3 years, it was very much a small project. We were trying to put it together. And then more recently, in 2017, the Ministry of Health in Ontario have funded the eConsult service as a full program. So that's what really allowed us to expand, and in particular to be doing expansion into the long-term care community.
Great, thank you. And for the actual initial startup, is there anything that a physician would need in terms of accessing this particular tool?
Well, you need to have your own account. So it is all private. It's on a secure network. So you have to have a username and your own password, but otherwise it's a web portal. So it can be accessed on your smartphone, on your computer, laptop, anything. So it's very easy mode of communication. And a lot of physicians, particularly if you're working in different environments, would access it through either their laptop or in fact their smartphone.
Perfect. Thank you so much. So, Dr. Fung, in terms of how this is used within long-term care, what does that workflow look like in long-term care for when you're using eConsult?
So I think eConsult solutions are pretty variable and a bit dependent on the environment in which they're being used. So eConsult, even as a primary care physician in the community, you can, as Dr. Liddy just mentioned, you can just access it on your smartphone. So as a provider in long-term care, you can essentially do the same thing. So you can log in with your username and password and submit the case on your own through the secure portal. In our environment, we've been fortunate enough to have some clerical support to allow us to support our clinicians in making those submissions on behalf of our residents. And the benefit to that is that it ends up being incorporated into our electronic health record, and it's available to be seen readily by other providers, by our nursing staff, even by our administrators. And so in our environment, we've been fortunate to create some workarounds to allow a delegated model where we have some clerical support that can navigate the portal on our behalf. But ultimately, the question is still driven from the clinician, directed directly to the specialist on behalf of a particular resident.
And what is the feedback that you've heard from family members and from residents that eConsult has been used for the turnaround time?
Well, I mean, the turnaround time is something that really, for a lot of our residents, was an issue in the traditional sense, because as long-term care has evolved, we're seeing an increased complexity as far as the medical care needs of the residents who are entering long-term care. We're seeing reduced lengths of stay, which is really indicative of a person's fragility and a person's frailty. So on average, people will live in long-term care for approximately 18 months at this time. And so there are times where wait lists for specialist appointments were, 9 months. That's not a very realistic way to address a problem that someone is sort of living with now. And so in a lot of ways, access to specialist advice was really limited before something like eConsult existed, because you would never initiate the referral because you weren't going to get the answer in a time frame that was going to allow you to change the care that you were providing for that resident. So with the advent of eConsult and being able to get advice within 1 week, it has really opened up opportunities that were just frankly non-existent before. And there's many skilled clinicians who are working in long-term care who are very well-versed in complex comorbidities and advanced frailty. But that being said, we all will run into a question that, we will say, oh, I wonder if there's a different way to approach this. I'm not quite sure where to start on this. And many physicians working in long-term care, it's a very sort of solo practice. You're not necessarily in a group environment. You're visiting once a week. You won't necessarily have colleagues immediately around you to just bounce off ideas. And so having access to something like eConsult, where it's a way to address some non-urgent issues, but get timely advice that you can actually enact in real time in the setting that you're in. It's really been a huge change for the way providers can enhance the clinical care that they're providing. As Dr. Liddy said, it's not a replacement for the face-to-face consult. There's times where that still remains appropriate and remains necessary. But I think that from a family perspective, there's many families who have experienced wanting to just know what the options are without necessarily wanting to go through the 3-month wait, the transportation, the appointment itself. And a lot of our residents, the statistics in Ontario, I mean, at least 90% of residents in long-term care have some form of cognitive impairment. 60% have a confirmed formal diagnosis of dementia. The vast majority live with numerous comorbidities. Attending appointments is not an easy task for the resident, let alone the family members who will often have to accompany them. And so sometimes we'll discover something and we may not feel comfortable as the primary care provider in being able to say all the possible outcomes of this particular finding. And the family aren't keen, or the resident isn't keen on necessarily doing something about it, but they want some more information. And that's where eConsult has been tremendously helpful. Instead of saying your only opportunity to get more information is to either go through the emerge and hope that you encounter the specialist that you're hoping to encounter, or for us to put you on a wait list to see a specialist in 6 months. Now we have this other option to really be able to inform our residents and our family members and really empower them in their decision-making about how they want to proceed with their medical conditions, and be in the position as the primary care provider to have those conversations, understanding what is important to them, what are they facing, and what is the outcome that they would feel was satisfactory.
That's great. So, and as well, Dr. Fung, what are the specialties that you have noticed that are the primary ones that you're sending the referrals off to?
So I think what we're seeing out of our region is that dermatology is by far number one. And I think that is certainly reflective of the challenges I think that's certainly reflective of the challenges that come with people being able to attend external appointments, as well as the traditional wait list to see a dermatologist, which was, depending on who it is you're referring to, can easily be over 6 months. And so oftentimes, in our elderly residents, skin lesions appear, and oftentimes you're not really wanting to do an awful lot about them, but you want to understand what it is you're looking at, what's the course of this particular diagnoses, and what are the options, and then be able to be informed with that information and inform the resident and family to allow them to make a decision about what they feel is important at that time. So dermatology is a huge one. I think also in our region, we see a reasonable amount of referral to geriatrics, and I think that probably encompasses several things like deprescribing medications and addressing numerous chronic comorbidities. And then I think we also see the sort of very traditional internal medicine-y things, which would be expected in our type of population as well, as far as cardiology goes, nephrology. These types of referrals are the ones we're seeing. But when you look at the numbers, there's a vast array of specialties being accessed, even if they may not be the most popular. And I think that ability to ask questions to, the set of specialists that have been made available is really of tremendous benefit to the providers.
Absolutely. Basically on your population, exactly in terms of who is going to be primarily that you'll be reaching out to for these types of consultations. And then, of course, to know that is, there's other specialties that everybody can access as well. Now, Dr. Liddy, in regards to how does someone sign up for the eConsult? Let's say a specialist, is it being expanded to nurses at all, or nurse practitioners that they can be able to, send off in terms of to find out from a specialist as to, what would be the next steps?
Yeah, that's right. So anybody who has the scope of practice to initiate a normal referral can access eConsult. So right now, then that includes nurse practitioners and then also family doctors. And then we do have specialists who will ask questions as well. But in order to sign up, primarily for the whole province of Ontario now, since it was funded, it's being hosted on the Ontario Telemedicine Network. And so nurse practitioners and family doctors and specialists all can have free access to an account on the Ontario Telemedicine Network and can access basically eConsult through that. They need to go through, as I said, credentialing just to ensure that they've got an account and a username and a password. And then we have mostly there's a very simple video that you can look at to do training, or you can have one-on-one. So it's simply a matter of reaching out to that. We also here, located in Ottawa at the Ottawa Hospital, we have the central organization sort of center for eConsult. So that's the Ontario eConsult Center of Excellence. And again, we have a small team here who is available to sign up anybody who needs to be signed up. So the best thing, and I think we had provided the links, there's a web link to be able to make that request. Quite a few people might have accounts with the Ontario Telemedicine Network for other things too, such as telemedicine. Those would be video visits, and they would automatically already have an account for eConsult. So that's a lot of the work that we've been trying to do in the last year, is really spread the word. And we do have partners across many of the regions now in Ontario, local sort of regional centers who are there to assist with the sign up and just get people up and going on eConsult.
And now, thank you so much. And now now that we're in the pandemic and most things are going online, have you noticed more of an uptake in terms of long-term care facilities now reaching out to find out how they can be able to now subscribe to the service and to be able to offer that to their residents, since things definitely have to be more virtual? And in this time, we're definitely going to be within this pandemic for quite some time.
Yeah, we have certainly seen an increase, and because there's so many more, as you said, sort of interest and realization that virtual visits or non-face-to-face ways of accessing care are positive, especially in these times. And yes, we have seen an uptake in the numbers. There's still work to be done, though. I think we're really trying to get the word out, in particular to the rural areas, to some of the smaller homes, that this is a service that's available free of charge, easy to get onto it. It is balanced with, as you know, like the incredible workload and stressors because of just COVID-19 in those homes, though. So that's where it is can sometimes be hard for people to think about taking on something new. So our message is that, well, it's easy. We're here to help. It's free. And actually, it is, as Dr. Fung said, an amazing way to access specialist advice, especially these days. And since the COVID-19 pandemic started, as of mid-March, we actually have a COVID-19 specialty group that's available on eConsult. And it's quite interesting because you can ask questions that would be specific to your resident, about the management of COVID-19 or anything related to that. But you can also ask questions to infection control specialists about your institutional sort of recommendations and anything, related to public health measures, and they'll answer all questions on that. So that has really been seen as a very useful service. And again, from an equity point of view, this is a very straightforward service, and we have a bank of specialists who are available across all regions of Ontario. So it is leveling the playing field and providing access to advice for people who live everywhere, even if you're not in one of the big cities.
Well, that's great to hear. And that's good to know. So right now you said that it's available across the province. And right now, in terms of the northern regions, the uptake in those regions, is that increasing that you're noticing?
Yes, yeah, but slowly. Yeah. And again, I think in the long-term care environment, it's just because of it's been such so much hard work and competing demands just in terms of trying to keep people healthy and dealing with all of the issues over the last few months. So again, our message is that eConsult is available. It's free. If you're a family doctor, if you're a nurse practitioner in long-term care, you can easily access. Just take you about half an hour maybe to get set up, and then you're good to go. And the answers, as Dr. Fung said, they are they just come so fast that it's really it's such a positive experience to be able to then follow up with your resident, with the family, and, say, well, I've got, discuss the case with the specialist. Here's what the suggestions are. Here's what you could do. Again, it's just so timely that it's a really great way to deliver better care.
Thank you so much. I really do appreciate both of your times for this and to be able to discuss eConsult. And thank you again.
Thanks for your interest.
Thank you.
Bye-bye.
Bye. Thank you for listening to today's show. And if you have any feedback or suggestions for this or any other episode, please contact us on our social media at Twitter at Family Councils and at Facebook, Family Councils Collaborative Alliance. Thank you so much and hope you enjoyed this episode.